Today, I'd like to talk to you about our N95 respirator stock. I'd like to begin by reviewing the difference between an N95 respirator and a surgical or procedure mask. A procedure mask is a loose-fitting barrier that does not require fit testing. Compare that to an N95 respirator, which requires a tight seal and requires fit testing. Last year at this time, Alberta Health Services had fit tested 15,000 staff to N95 respirators. This year, we've done a tremendous job in responding to the need in protecting staff from the COVID pandemic. We've tripled our fit testing capacity and fit tested over 49,000 staff to N95 respirators. I'd like to express my gratitude to the fit test designates that have assisted AHS with this effort. AHS has over 500 fit test designates. These are frontline workers that Workplace Health and Safety has trained to assist and fit test our staff. I'd also like to extend a thanks to CPSM. CPSM has been an integral partner in helping us work to preserve our N95 stockpile, find alternative N95 respirators, and stock our facilities with adequate PPE supplies. And last, I'd like to thank the WHS teams that have gone above and beyond by working long hours, evenings, weekends to run fit test clinics across the province. Let's review the respirators that we are no longer using because of supply chain concerns. The 1870 Plus is the workhorse respirator that we've relied on prior to COVID. This respirator is no longer available, and we are actively moving to fit test people away from this respirator. The 9105S and the 9105 respirator are two other key respirators that we've used in the past that are no longer available and we're moving away from. Over the past 8 months, WHS has began to assist with that conversion by fit testing people to the 8210 respirator. This is a cone style 3M respirator that has been our #1 respirator that we've been fit testing staff to. The 8110S respirator is the second most used respirator, also a 3M product, and a smaller style than the 8210. Our third most used respirator is the 1804 V-Flex respirator, also a 3M product. It fits a slightly larger face style. And recently, we've added the Dashang DTC3Z respirator. Similar to the 3M 1870 Plus, this is a new product that we have recently acquired and are actively fit testing staff to this one now. As CPSM monitors our active stockpiles, we've been monitoring the rate of usage and the total N95 stockpiles. We've identified that the 8110S is a respirator that we are going to be switching out with the 1860S. A very similar respirator. Expect to see this new respirator in stock very soon. The 8110S respirator, if you are fit tested to this, you can still continue using this, but we will no longer be fit testing any further staff to this respirator at this time. To further diversify the utilization of our N95 respirators, we've decided to make the decision to make the Dashang respirator the #1 respirator. So starting this week, our N95 fit test teams will be using this as the #1 choice. Thank you for giving me the opportunity to review with you these N95 respirator options. If you have any further questions, please feel free to contact your WHS team. Stay safe, everyone.
Together, we do amazing things every day.